African, a very, very, very warm welcome to you. This is Afternoon Express. My name is Jeannie D. I hope that you are having a really beautiful day thus far. Now, coming up on the show today, it is all about health and wellness as we look at one of the most common viruses in the world, HPV. Its association with cervical cancer means that women who contract the virus are at a much higher risk. Now, currently, the Department of Health is actually visiting schools around South Africa, offering the first round of vaccinations to girls. But first up, we celebrate healthcare professionals who have gone beyond the call of duty to help others. It's an initiative by Adcock Ingram and News 24 that aims to celebrate the often overlooked individuals who save lives on a daily basis.
I've never met someone with a heart like this.
He embodies what it means to be selfless.
Even when I was in a state of panic, she saw me through bravery.
Often the bravest people don't see themselves as others do. Join us in celebrating these brave heroes. Nominate the pharmacists and healthcare professionals in your community making a real difference and stand a chance to win 5,000 Rand.
Wow, this is absolutely going to be such a fantastic campaign. Now, of course, acts of ordinary courage, of brave compassion that put health of patients first. These are definitely the everyday heroes of the healthcare profession. Now, join News 24 and Adcock Ingram OTC in celebrating and sharing your stories of pharmacists, pharmacies, and healthcare professionals who have gone above and beyond the day-to-day call of duty. We are here, of course, at Afternoon Express, and we are so proud to bring you sponsors of Brave. And of course, we chat to Financial Director of Adcock Ingram Over the Counter, Yudhvir Singh, and Andrea Firth, Editor of Brand Studio 24, about this amazing campaign. Welcome to the show.
Thank you.
Lovely to see you. Lovely to see you again. What a beautiful, beautiful campaign. Where did you get the idea from? Why is it important to do a campaign like this?
So, Jeannie, thank you very much. When we looked at it, if you look at the world currently, there's a lot of negative news that's out there, and it takes center stage. And I suppose it's human nature as well, where we elaborate on everything that's going out negative and we tend to share it. And that dampens everyone's mood. We started this campaign in order to lighten everyone's mood and improve it. It's also an opportunity to give South Africans the opportunity to nominate their fellow South Africans who are doing good and doing the right thing out there.
Yeah.
One of the items that we saw was the healthcare professionals, which are your doctors, your nurses, your pharmacists, and your paramedics, etc.
Yeah.
And these individuals, they spend most of their lives helping and serving us, but we very rarely afford them the acknowledgement and celebration that they deserve.
Yeah.
Hence, we created this platform where we give an opportunity to South Africans to go out there and nominate their healthcare professional who has changed their life, who has done something that's beyond and above the normal call of duty under the banner of bravery.
Yeah, and I love the word brave. What does bravery mean to you?
You know, that's very subjective. So different people have different definitions of bravery, and it's very, depends who the eyes of the beholder are. So for me personally, bravery is, and I'm going to give you an example. So we did a small campaign in the office where we asked everyone what they thought bravery was. And each and every individual came back with a different definition of bravery.
Yeah.
But it resonated with them, and in their eyes, what they were seeing was bravery. Even in certain instances where it's basic daily tasks for one person, but for somebody else it might have been a brave task. A scenario that's very close to home for myself. My granddad's 91.
Congratulations.
Thank you.
Hello, Granddad. I hope he's watching.
I hope so too. And about a year ago, he hurt his leg and he had to go for an operation at the age of 90. And he's one of the bravest people that I know.
Wow.
For me, that resonates with me, and that's bravery for me.
I love that. What are the values, and I suppose the core values at Adcock Ingram OTC, and how does it align with a campaign like this?
So at Adcock Ingram OTC, we're a company that's of high ethical values, integrity. We have great quality products. We're a company that's big on empowerment and good corporate governance. Now, in today's world, in today's times, in order to hold these values, you have to be brave. Bravery is about doing the right thing no matter what. Bravery is about making sure that we improve society and we have a healthier society. Bravery is about holding your head high and being positive, even in negative times.
Yeah.
And bravery is working towards making South Africa better for today and for the future. And this is why at Adcock Ingram OTC, we are sponsors of Brave.
And times are tough at the moment. Like, the economy is rough. I mean, there is like a little lull of whatever in society. So I really, really love the focus on focusing on the positive as opposed to the negative.
Yeah, so there's a lot of negative that's out there, but if you'll see on social media, you'll see bits and balls come through that there are positive aspects that happen out there. We tend not to amplify that and celebrate that the way we should. Those are good things that people are doing out there, even if they are small. They're still things that we should take there and spread the word. What it does, it creates this environment where everyone is spreading the good as well, and it encourages everyone to do good as well.
Yeah. Andrea, why is this campaign so important to News 24 as well?
You know, News 24 is one of the largest digital news agencies, and we're incredibly excited to be able to use that reach that we have to share these good stories, these feel-good moments, these extraordinary stories of ordinary people that make you proudly South African.
Yeah. Yeah, and why is it important to celebrate them? I mean, besides the obvious answer.
You know, unsung heroes are the people who are going above and beyond in their ordinary everyday life, and they often don't get the recognition. You know, they're the change we want to see in the world, to quote Gandhi. And it's so important to kind of shine a light on these people and go, thank you. We see your acts of service. And by highlighting them, maybe we can encourage more South Africans to act with kindness towards each other.
100%. And I think this is such an important campaign as well for people, part of the healthcare industry as well. Like if you look at your health professionals, your pharmacists, your paramedics, they really, really need a little bit of a boost, hey, don't you think?
I think healthcare professionals are one of those overlooked professions. You know, it's not just a 9 to 5, it's a calling for many people, and we see them at our worst times when a friend or a family member or we are ill and sick, and they're there to support us, to pull us through, to put our well-being before their own. And because of that, you know, it's really important that as a sector, as a profession, that these healthcare professionals are lifted up and we say thank you for what you're doing.
This couldn't happen often enough. If I tell you, like the minute you think of what paramedics do, and, you know, when you've been in a situation where you've needed a nurse, they are angels. They are absolute angels, and I don't think that they get thanked enough. What are the mechanics of this competition and of the campaign?
Okay, super simple. We have a website, partners24.com/sponsors of Brave. Go on. There's a big button that says enter and win 5,000 Rand. You hit that button and it's a really simple entry form. We ask you for a couple of contact details so that we can contact you should you be a winner. And then we ask you just to tell your story of the person you're nominating. You know, what have they done? Why are they brave? Who are they? And that's it. You're entered.
Yeah. And I'm a judge, which I'm really, really so proud to be associated with this. But why is it important for people to nominate their favourite, you know, health professional, other than the fact that they'll get 5,000?
Well, of course, it's a huge incentive right there. There's a 5,000 Rand weekly prize that could be given out to people who nominate. And that's a big factor. But I think, you know, again, highlighting these stories, telling these stories as South Africans, really promoting the spirit of Ubuntu and kindness amongst each other is really, really important for us, especially at this time in South Africa.
Yeah. I've got an amazing pharmacist, but since I'm a judge, I won't nominate him. But thank you very much for being here today and for sharing this fantastic campaign with us. It's really, really amazing. Now, one of South Africa's very own homegrown heroes is, of course, Derek Watts, a journalist and well-known personality. And I don't know, in my opinion, Derek definitely personifies bravery and is one of the sponsors of Brave Ambassadors. And we have him joining us live from Johannesburg after the break.
My name is Trevor Lagoy and I'm 34. Up until recently, I had a gym and that gave me the flexibility for other passions, which meant obstacle course racing. I competed around the world as an elite obstacle course racer. Entering Tropica Island Treasure Season 9, I'd seen it on TV, so I was like, oh, I've got the availability, so let's go for it, and who knows.
He puts his body on the line and he doesn't give up.
If I win, I will definitely put a big portion of the money towards very close friends of ours that have a child that has muscle dystrophy.
Lucas was diagnosed with LMNA CMD, congenital muscular dystrophy. Internationally, there's about 7 of them. Lucas means light, and the whole idea behind it is to give hope.
We're all so grateful for him and Daniela. When you have people like that, it's like actually kind of cool, sorry.
Oh, how can you not be excited in getting the opportunity to go to an island to play for 1 million Rand? Tropica Island of Treasure, Season 9, coming soon to SABC3.
Good afternoon, South Africa. Welcome back to Afternoon Express. My name is Melissa Wallace, and I'm coming to you live from Bryanston, Johannesburg, where we are saluting all of the unsung heroes in our communities. And sitting beside me is legendary journalist and, of course, an ambassador for sponsors of Brave. I'm speaking about Mr. Derek Watts. Now, thank you so much, first of all, for spending the time with us and kind of breaking down such an important topic. And not only that, but being the face and the ambassador of such a worthy cause. What does it mean to you, and why did you decide to get involved?
Great to meet you, Melissa. And of course, I've seen you on the TV, but you're even more gorgeous live. Yeah, why did I get involved? Well, first of all, I think there's a lot of depression, negativity around the country. I think we all feel it. I made a New Year resolution not to get into the discussions about the usual ones, you know them, crime, corruption, ESCOM, blackouts, unless somebody brings something to the table that is positive. It doesn't have to solve the whole problem, but just changes the whole conversation. Otherwise, for me, it just goes through the whole process again. So it resonated with my beliefs that we've got to look for positivity. And along with carte blanches, you know, during the festive season, we did a lot of programs on the unsung heroes, people who don't get the recognition. There's so many out there, so many brave people, brave journalists. And, excuse me, and we saluted the brave journalists recently on Sponsors of Brave.
Yeah. So we speak about brave and what does that courageousness look like. So I want to find out from you, Derek, who's seen a lot within our country and globally. But what does being brave mean to you?
Well, I like working with a brave team. So I think we've got a very brave team at Carte Blanche. It means to me, I think the first thing is resisting temptation. And that sounds easy. But it's not so easy, is it? Hey?
Not at all.
I mean, we talk about this cowboy country. We blame the police. And yet many of us will hand over a bribe. How does that work? It means not accepting the status quo, trying to change things. It means uplifting the people of this country because, you know, we're not as badly affected as most people, you know, living in, you know, shacks, living in informal settlements. And yet I meet many of those people who can still bring a smile to their face, who can still be positive. And I think, you know, on another level, how brave are those people?
Wow.
And, I mean, I see them on the Nickel Highway, people are selling trinkets and some people won't even greet them. You don't have to buy their trinkets, but just respond, give them a smile. Respect, because there are many brave people in this country and they don't always get recognition.
I think that is such a beautiful point that you've highlighted, is that it's being courageous, it's stepping outside of the norm and doing something that necessarily your neighbor isn't as courageous to do. You stepping in and saying, enough is enough, I'm going to stand for something more, something better, and something that's going to push us forward as a nation. So why do you think it is so important for us to salute these people? Why do you think it is so important to celebrate all the courageous, brave people that we find within us?
Well, I think the country is in a crisis. It's not just me. I mean, the Treasury is saying that unless there are brave decisions and drastic reductions in the public service, we are in trouble. We're going down a slippery slope. So that's, of course, where a lot of brave decisions have to be made. But this goes across to healthcare. And you've seen the parlous state of the hospital estates, the state hospitals. A lot of medication isn't available. Psychiatric wards in particular are just in a truly shocking state, and that's with people who are trying to recover. So it's at a crucial time for the country. And yeah, we're talking about pharmaceuticals, and I think it's great that a country is willing to stand up and tackle the problem head on.
It sounds a lot easier said than done. A lot of South Africans out there are standing there saying, how do we do this? What is the next step forward? So I want to find out from you, as a judge of this incredible campaign and this competition, essentially, what are you looking for in those brave human beings that are in the health sector right now? If anyone is watching at home and wants to make the difference and be the difference that you speak of, What does that look like?
Well, you may have seen some of the stories we've done on extremely dodgy pharmacists, on codeine addiction, serious problems. And these are some of the issues that have to be tackled, obviously. So, I mean, as a personal example, I went to the chemist the other day, and normally with the OTC stuff, over the counter, you know what that is, you just say what you want. And now this pharmacist started asking me questions. And
what are you using it for?
Yeah. I was quite indignant at first. I thought, well, this is a bit invasive. And he said, but you got some of this last month. Yeah. I said, yeah, just take one a day. What's wrong with that? And he said, but yeah, what are you trying to treat? And he went into my whole lifestyle and changed some of the tablets I normally take and substituted some. But what was he doing? He was taking an interest. And that's what I think a great pharmacist must do. Take an interest, not just hand over the tablets or pharmaceuticals if they're on prescription. Because really, how many of us read the fine print? Do you?
Definitely not me. I'm in South Africa. I'll be the first person to say. And a lot of pharmacists don't hold you accountable. A lot of them don't track your previous record and say, hang on, you've definitely treated this a couple of times before. So what are we getting down to here? Let us help you and help you in the best way ever. You seem to be quite confident in how you stand and what you're looking for in these health professionals that you're seeking and saluting with sponsors of Brave.
Absolutely, because, I mean, we've done other stories on antibiotics, which crucially should only be given in terms of the last resort, and where doctors are prescribing them.
Meant to, yes, I know them as something just to treat.
But there are some that will affect you bad physically, that you might even break your Achilles. But it's in that chain between the doctors and the pharmacists. And, of course, mainly now we're talking about over-the-counter. But, somewhere in that chain, everything has to tighten up.
Yeah. Holding people accountable, cracking the whip. Finally, Derek, before I let you go, I have to find out from you, what advice would you give health professionals out there, people that are in these communities where situations are dire and they're not looking good, but they are the shining lights? And, of course, someone who's come from a very personal experience where at a young age your daughter had a very traumatic experience that shook the entire family, where she had a brain tumor. What advice, what do you have to say to these people that are in these communities?
Well, first of all, I think nothing can prepare you as a parent for being told that your daughter's got a brain tumor. Your world falls apart. And with all these health professionals, from the MRI scan team, from the pediatricians, right along to the, neurosurgeon who does the 7-hour operation, they're seeing this on a daily basis. And for you, everything has changed. But what I admire is how, and I've seen it at all levels, I've seen it at government level, private hospital level, there are just some health practitioners who've got that side to them that isn't just the professional side. It's got they're still caring, although every day they have to break the terrible news. And I remember the neurosurgeon, Carl, just went up to my daughter with a scan and said, this is what's going to happen, this is what I'm going to do. And we felt left out. But my daughter afterwards said she felt so much more confident being told the truth. So it's a difficult question. But, look, it went on. She's healthy. She's got a business science degree, and she started a little foundation, the Kirsty Watts Foundation, which is, built a lot of hospital wards, classrooms, computer labs, even sensory rooms for autistic children. So when I say she's done it, it's along with my wife, Belinda, but it's made a nice difference. So it's good to feel that out of that traumatic experience has grown something where young people can be benefiting.
And this is just a story of bravery. This is a story of being triumphant and people coming together to not only be the change, but make the change moving forward. So a huge shout out and love goes to your daughter, Kirsten, of course, your wife.
She took me through it. I mean, she was and is incredibly brave.
Absolutely.
And so is my wife.
And so are you. Thank you so much for championing this cause. Thank you so much for allowing and enabling your face to be right up there as an ambassador for such a worthy cause. This is us here on Afternoon Express saluting all the unsung heroes in the medical professions that are in communities making a difference. Thank you so much, Derek.
Yeah, it's been great to see you. Super.
Absolutely.
You're a hugger, though.
I am a hugger. Going back.
I've never met someone with a heart like this.
He embodies what it means to be selfless.
Even when I was in a state of panic, she saw me through bravery.
Often the bravest people don't see themselves as others do. Join us in celebrating these brave heroes. Nominate the pharmacists and healthcare professionals in your community making a real difference and stand a chance to win 5,000 Rand.
Derek Watts is truly such a lovely, lovely man, and this campaign is incredible. Now, you at home can get involved by nominating the pharmacist or healthcare professional in your community making a real difference, and you can stand a chance to win 5,000 Rand. Plus, there will be 2 winners from the nominations. So the judges will select one winner, and your votes will select the other winner. So these winners will win a trip to an overseas medical conference of their choice for themselves, and of course, the opportunity to pay it forward by donating 25,000 Rand to a registered NPO charity of their choice. So to nominate, please go to news24.com or https://partners24.com/sponsors of Brave. All of that information will, of course, be on afternoonexpress.co.za as well.
I've never met someone with a heart like this.
He embodies what it means to be selfless.
Even when I was in a state of panic, she saw me through bravery.
Often the bravest people don't see themselves as others do. Join us in celebrating these brave heroes. Nominate the pharmacists and healthcare professionals in your community making a real difference and stand a chance to win 5,000 Rand.
Now, speaking about health, it's time to get really healthy. Being well, of course, starts with eating well, and Woolworths is, of course, here to make sure that you give you and your family the best nutrition that they can get. Like, of course, my favorite, this is literally what I live on, these Woolies cold-pressed juices. Now, being well also means that you have to make time for yourself and make time for exercise in a busy schedule. Now, here to share a few tips and show us a few exercises to motivate you to live your best life is one of my favorite personal trainers of all time, Cameron Aberdeen. Welcome.
Thank you, Jeannie.
Thank you for being here again. So I saw you at the gym this morning, and you know what the problem is? Firstly, I never get time to go to gym. And then when I do have time to get to gym, I just don't know what to do when I'm there, and I walk around like a bit useless.
Unless you're with me.
Unless I'm with you. But give me some advice on what I can do and what some women at home can do if they've got really busy lives and if they're moms and they don't have time to get to a gym and they need to be healthy and living their best life.
Okay, so in terms of what I would advise for moms, you mentioned unsung heroes earlier.
Yeah.
I think that would be safe to say they fall into that category.
Yeah.
But what they're really bad at is making themselves a priority.
Yeah,
so that would be a good place to start. Dedicate a certain amount of time, doesn't have to be much, half an hour, 45 minutes, just to some exercise that's going to keep you mentally and physically healthy.
Okay. And then for when they are making themselves a priority, at home, maybe watching the show, can you give us like a few little easy exercises that'll make a big difference?
I've got 4 exercises that we can do. Now, ideally, we want to compound everything because that's going to save time as well, which means adding in a few movements to create one.
Okay.
A good way to start would be on the floor to warm up your core and your glutes.
Yeah.
So what we can do is go down into a 4-point
I'm not going to do this one because
I'll take care
my
of
pants are too fabulous, to be honest.
One leg up, one arm up. Now, this is a good static core exercise, but if we add in an element of a crunch and a stretch.
Now, I find that exercise quite easy. Is it really working? Must I just keep on doing it?
It is really working.
Okay, good.
Very good for core, very good for glute activation.
Nice.
Secondly, what we can do is a multi-directional lunge. Now, this is something that requires a little bit of space, so I'll just do one side.
Okay.
But if we go forward, side and slightly back, you hit more than one area
that I can
of the
feel.
leg,
That's
which will
already
also save
targeted.
some more time. Another exercise we can do, and now this one will require a little bit of resistance if we do have dumbbells at home, is a dumbbell thruster. So into a squat, down and up. I'm going to let you try that one.
Okay, I like these actually. Like, to be fair,
And
girls
press.
cannot squat enough.
And press. Good.
It's true.
Down.
Girls, trust me, you
Press.
cannot squat enough.
Good.
Just do this and then have a little
And if you
look-see. You'll be happy with what you see.
And if you are giving yourself a little bit of a rest from the lower body, what we can do is focus on upper body with some bicep curls into a shoulder press above the head.
Okay.
Breathing out as you press.
Love it.
And down. Perfect.
Okay, something else that I also do, obviously, before and after gym, and because gymming obviously isn't my main priority, eating well is really my main priority. Cold pressed juices. I love juicing. I love juicing. What's your take on juicing? And when should, like sometimes first thing in the morning when I haven't had breakfast, I'm a little bit tired to go to gym. Should I have a juice then or do I have a juice after?
Look, it depends on what's in the juice. Ideally, I would say preferably after gym. Use it to replenish and recover from your workout. Good way to get in some vitamins and minerals.
Okay, these are obviously made in a little high-pressure process, and of course they're very cold-pressed. And what I normally do, like at home, was take all of my fruits and all of my veggies, and it just is such a mission. So these are way more convenient, and obviously you're getting all of your nutrients fresh every single day.
Exactly.
They are amazing. Which one would you like?
I would go for, I'm going to say the charcoal. Activated charcoal.
Yeah, that
would be
is
great.
so nice.
Yeah.
These have got an amazing shelf life, so you can keep them in your fridge, and they really are amazing for you. There's your this one's actually my favorite. It's the apple, ginger, and lemon. Trust me, it is delicious. Definitely my number one. So these Woolies 100% cold pressed fruit and vegetable juices are definitely my favorite things of all time at the moment. And the cold press machine is so highly pressured, it applies no heat and therefore no loss of nutrients. And of course, it has a longer shelf life than your normal cold pressed juices. Now, it is really perfectly nutritional and it's a good booster after your exercise workout. We're going to see you after the break, after we have our own little boost. Cheers.
Find your smooth fortune with Tropica. Buy a Tropica promo pack, enter now, and stand a chance to win your share of 1 million rand in prizes and the smooth grand prize of a Suzuki Ignis. The more Tropica you buy, the more chances you have to win.
Also catch the new season of Tropica Island of Treasure Curacao every Tuesday, 7:30 p.m. on SABC3 from the 3rd of March.
Tropica, nothing smoother.
Clover No-Lac, lactose-free milk that lets you enjoy dairy again. Made with love by Clover.
Welcome back to Afternoon Express, and of course I can always be found in the kitchen. It really is my favorite place in the home. Now, thanks to Clover No-Lac, it's a really versatile lactose-free milk. You can enjoy dairy again. Now, today, food and fitness blogger Zintle Nchikes shows us, and Nchiki, how do I say your surname? Nchikile. Shows us just how to do that, even if you are lactose intolerant, with a delicious No-Lac spicy peanut cream with wings and pickled veg recipe. Oh, this is good, girl. Of course, all you need to do is SMS the keyword Clover to 33650 to get the recipe. It's R1.50 and no free SMSs apply. Okay. Oh, this sounds amazing. Right. And it sounds quite easy to make. Now that I'm becoming a little kitchen pro, you can show me the ropes. How do we get started?
We've got our winglets here. Yeah. We cut them in drumlets, and then we just, we've got our honey here, we've got our fish sauce, soy sauce. It's quite an easy recipe. And then we've got our lemon zest there. And then we first, let's first put the ingredients.
Honey first.
Honey first.
Okay, that's what gives it that nice
sticky, yes, that yumminess. Right, and then we go with the soy sauce.
Yeah.
And
what is that, the fish sauce?
Fish sauce, yeah.
Why fish sauce? To give it a little umami?
That Asian-y type of thing, yes.
That's true.
There we go. And then our zest there.
Love.
And then we stir it, just bring it together. Together with the honey.
Start dunking the chicken in.
Yes. And then we dunk the chicken.
Don't want to stain our outfits. There we go.
Okay, just twist it, just...
I love doing stuff like this, especially in honey.
The messy stuff.
It's like,
The messy stuff.
Ooh, this is so nice.
Right?
Yeah, this is great. Because, will this kind of marinate it? Like, the longer you leave it in this...
The taste, I was going to say. I was just about to say. Like, you can just set it there and then put it aside.
I won't take over anymore.
And then, and then we throw it in the tray.
With all of the sauce
With all of the sauce. Because just now it cooks in, and then it's going to burn if it's nice and dry, and it's so this will help it to a bit cook.
It's amazing. That texture is almost like a
juicy.
molasses kind of. Oh, that's going to be so delicious.
And then we pop it in the oven at 180, say about 15-20 minutes.
Yeah, Chumi was telling me yesterday that 180 is the lucky number. She says...
You're safe.
Yeah,
if you can't bake like you can't cook like you, 180 is safe.
Exactly.
So, and then we've got our... peanuts here with a peanut sauce.
Sure.
And then we throw the peanut in.
Yeah.
And then we've got our chili there. Yeah. And then we've got a bit of pepper there.
And this is going to go over that sauce?
Yes.
Oh, wow, this is going to be so decadent.
We're going to plate with
tasty.
it. And
sauce
then,
above sauce above sauce.
Yeah, that lemon juice.
Yeah.
And then our hero of the day.
Yeah.
Our Clover No-Lac.
This is so interesting.
Right?
I've actually
You
never
just bring
seen
it
this
to the
done
boil.
before. Yeah.
And then just let it cool down, and then before you blend it.
Okay.
And
so you mush it up.
Yeah.
And then this is what...
Yes, this is our result.
Oh, delicious. So there you go. We've pulled those out of the oven before we got started on the show. And then how do we piece it all together?
We've got our pickled veggies here.
Yeah.
And then we just throw it in as you wish.
Beautiful. You know what you could actually also do with this, which was my new favorite find, are those rice paper strips. So that comes out like quite a hard round thing, and you put it under water, and then you fold it, and then you get those Asian little rolls.
Yes, those cute little things.
This is perfect for that as well.
Yeah. So you do that. You just pick.
Yeah.
Yeah.
The pickled veg.
And then
I want to have a little taste of what you've done here. Do you mind?
No, not at all.
I taste everything in the kitchen. I see with my mouth.
But where does it go?
Oh, that is delicious.
Amazing, right? Amazing, right?
But that's a good recipe that you want in your kitchen, just for anything.
Yeah.
Anything that you need that's a little bit Asian, Oriental, or nice chicken wings like that.
Okay, our pickled ginger there. We've got lime juice here. We've got our fish sauce again here. We've got rice white vinegar, and then our brown
sugar.
Yeah. And then we just mix them together.
Beautiful. This is to pickle them.
Yeah.
I love pickles. I'm addicted to pickles.
But you must be aware not to just over, because they're so thinly julienned.
Yeah.
And then the more they soak, the more, because you want that crunchiness that, when you plate, you don't want them
you don't want it to
like semi-dead, right?
Okay.
Yeah. And then
yum.
Let's do that. Our hero there again. Just go through there.
And that's got a really nice bite with that chili that was on it.
Yeah.
Delicious. Very, very nice. Do you want me to start layering your chicken strips?
Yeah. Let's do that first.
There you go.
Just a bit of
Not chicken
bit.
strips. What are they? Wings?
Winglets.
There you go. Oh, good. Nice and tasty.
You must remember, plating is a personal thing.
Oh, I know.
So however, right?
There you go. Beautiful. Piece of art. Well done. Thank you very, very much.
Simple recipe.
This is a recipe, trust me, that you need to keep stocked in your kitchen because you will definitely use it with any of these amazing dishes. All you need to do to get it is SMS the keyword Clover to 33650, and of course we'll send it directly to your phone. And just in case you missed out on how we made this delicious dish, watch this. I love this. Really nice.
Made with love by Clover. Clover No-Lac, lactose-free milk that lets you enjoy dairy again. Made with love by Clover.
Now on to something a little bit more serious. HPV is the most sexually transmitted virus in the world. It is the leading cause of cervical cancer, and anyone who is sexually active can get this virus. But this is not a reason to panic. There is a vaccine available, and Sister Ursula, a clinical nurse practitioner, joins us now to share a little bit of insight into HPV and the first round of vaccinations taking place in schools all around the country. Welcome to the show.
Thank you.
So let's start off with the basic. What is HPV?
HPV stands for the Human Papillomavirus, which is a small DNA virus. This virus can enter the skin, especially the mucosa of the cervix and the anogenital areas. It can also lead to cancer.
Okay. How do you know when you've got it? Does it does it transpire in any kinds of sores or lesions? Like what does it look like on the body?
The person who has HPV doesn't know that they do have an HPV infection, because there's no really signs or symptoms initially. The HPV enters the cells and it multiplies there, and so it doesn't appear in the bloodstream. So there's no immune response where the person feels sick like that to make them aware that they need to go see a doctor. Wow. So in the beginning, there's no signs really that the person have HPV infection.
So this is so worrying, because this means that people could be spreading it left, right and centre without even knowing that they have this virus.
Yes, and that's why I think this vaccine that we have at the moment is exceptionally good to preserve the life and the wellness of our young girls at school.
Yeah, absolutely. So what happens? So you guys are going to be going around to all of the schools and giving, it says, a first round of vaccines. How many rounds of the HPV vaccine do you need?
The Western Cape government have started on this HPV campaign a few years ago already. So what we are doing, we go to all the public schools and the children get consent forms. The parents need to give permission for us to give the child the HPV vaccine. They will get 2 doses of the HPV, one in the first round and one 6 months later. It will be given to the grade 5 learners, and the learner must be 9 years or older, but in grade 5. So the World Health Organization emphasizes that it's important that young girls get it as from the age of 9, because at that stage they respond better to be fully protected and for the uptake of the HPV vaccine.
Wow, this can literally save girls' lives. So very important that they get it. Thank you very much for sharing that information with us. Lovely to see you. Coming up after the break, we continue the conversation around HPV by looking at its link with cervical cancer. We'll be right back.
My name is Darren Solomon and I'm 22 years old. If you look good, you'll feel good, and if you feel good, you'll do good. The reason why I entered Tropica Island of Treasure Season 9, I'm a highly competitive person and I love a great challenge in life. I mean, as you can see, I've got the physique. Leading up to the competition, I'm going to be playing some mind puzzle games because I know that they're always going to throw in a cheeky twist on the island.
He's the most kind-hearted individual I've ever met. When it comes to his athletic abilities, 10 out of 10. His navigation skills, he's a bad navigator. So if he can just work on that, he'll be fine.
When I was selected as one of the candidates, the first people I told was my uncle and aunt.
I think Darren has a very, very good chance of winning. He's very much determined, he's super fit, and he's very competitive.
They were just like, what are you going to do next? What are you going to do next? And I was like, I don't know, I need to work out, I guess, for this show. Catch me on Tropica Island of Treasure, Curacao, coming to you soon on SABC 3.
Welcome back to Afternoon Express, and of course we are discussing HPV and its link to cervical cancer. Welcome to the show.
Thank you very much.
So, we've just heard previously from the sister explaining to us that, you know, you can contract HPV sexually, but now there's so many different kinds of HPV that you can get. Am I right?
That's right, yeah. So there are over 100 different types, but not all of them are associated with cancer or cervical cancer. There are only certain types, for example, type 16 and 18 and a few other types that can develop into cervical
So now
cancer.
a whole lot of girls around South Africa will be getting these vaccinations. What happens if somebody gets vaccinated and they've already got HPV?
That's okay. It can still be of benefit. So it is preferable, you know, for the vaccine to be administered prior to any sexual contact or sexual activity. It's most beneficial then, but it can still be beneficial if someone's already infected with HPV.
Okay. So once, I mean, how do the girls eventually find out that they have HPV, or does it only become aware to them when they go to a doctor and realize that they've got cervical cancer?
No, that is the point of cervical cancer screening. So the screening can pick up HPV infection or precancerous cells, and you can address it then straight away in the very early stages, and that can prevent cervical cancer from developing. That's why it's so important that women do go for cervical cancer.
So this is the only way that a girl will get cervical cancer is if she's contracted the sexually transmitted disease?
Yes, almost all cervical cancer cases are associated with HPV, but a lot of people can have HPV and not develop cervical cancer. It has to be the cancerous types, and then only in some people does it persist. Most of the time it resolves, the infection resolves, you're not even aware that you have it, no symptoms, as the sister said. And but it just in some cases it does progress and then go on to develop into cervical
So the other
cancer.
types of HPV that you get are actually not harmful?
They're associated with different things. So there's some types associated with genital warts, for example, which aren't cancerous, but of course, also not a nice thing to get. And other different diseases. But cervical cancer is obviously the one that has a significant impact in our country. It's the cancer with the highest mortality rate in South African women. Yeah.
How prevalent is it, and in what age groups? Like, when are women finding this?
It's probably, it's more sort of in, it increases from sort of 30 to 60. I'd say that period is the most common time when a woman would be diagnosed with cervical cancer.
And from the time that you contract HPV, is there can it lie dormant in your body and then eventually?
Yeah, it takes some time, which is why the cervical cancer screening program is so important, because it takes a while to develop, but the screening can pick it up really early before it becomes serious,
Yeah. Well, tell us about some of the treatments. So what happens if a girl finds out that she has either HPV or if she has cervical cancer? What are the options available to her?
It would really depend on the stage, so that would be something that the woman could discuss with her healthcare provider in terms of what the options are. It would depend very much on how far it had progressed as to what kind of treatments would be recommended.
But obviously, the earlier you find it,
Absolutely, yeah, that's the really important part. There's a much higher chance of survival, and the treatment is less invasive, etc. The earlier you find it. So, that's one of the problems that we have in South Africa is diagnosis at such a late stage. So that's why the cervical screening program is so important, and it is, with the policy that we have in place in South Africa at the moment, women are entitled to free screening.
I know, but how many women will just go for the screenings? If I think 30-year-old girls, surely it's something would already be wrong for them to want to go to a doctor to then go and have a test.
Yeah, well, it's something you have to do even when you're well. That's the thing about screening. It's going, and I think that's why a lot of people don't go. They think, well, why do I need to go? There's nothing wrong. I've got no symptoms or anything like that. But that is just something that's best to do regularly, because it really does save lives.
Yeah, it's good to know, because I honestly wouldn't even consider it. You wouldn't think about it in your regular life, and now this is something that a lot of girls really, really should be cognizant of.
Yeah.
Thank you so much. We're going to chat a little bit more after the break, and of course we've still got some more time with our HPV experts after the break. So if you've got any questions, please head over to our social media platforms now, and don't forget to use the hashtag Afternoon Express, and we'll try and answer all of them for you.
My name is I'm Benjana, and I'm 27 years of age. I step into other people's shoes for a living. In other words, I'm an actress. I'm excited to be on Tropica Island of Treasure Season 9 because I'm going to win that $1 million. Simple. I'm preparing for the island by doing what Beyonce does. I am working out twice a day. The most important people in my life are undoubtedly my family. I'm nothing without those people. My friends are 110% behind me for the TIOT9 competition. They think I'm going to bring it home, and I think I will too.
She is the Kate Moss to my Naomi, but the girl can sprint. It's actually scary. She's competitive, and she is always ready to win. She's always ready for a challenge, so she's going to win that thing. The other contestants better watch out.
Catch me on Tropica Island of Treasure, Curacao, only on SABC 3.
Welcome back to Afternoon Express. Now, the topic of today's health discussion is, of course, the human papillomavirus. And we're joined once again by our experts, Dr. Melissa Wallace and Sister Ursula Laka. Welcome back, ladies. So what are some of the stigmas around attached to HPV?
Shall I?
Yeah, anyone?
A lot of young people think that if they get the HPV vaccine, that they won't be able to bear children anymore. Some of them, the parents think it is a contraceptive that we're giving them.
Yeah.
Some of them think it will cause HIV. And then there's various other myths and myths that people...
Really?
Yeah.
This is such an important topic, though, and that's why people need to be educated on this. Tell me something. Does a condom prevent HPV if you use, you know, a condom during sex? Well, like, can HPV still be...
It helps, but it doesn't necessarily always prevent it because it's quite easily spread through skin-to-skin contact. It doesn't have to be bodily fluids.
Okay. Now, what should a young... So, now, what happens if a girl suspects that she has HPV or cervical cancer? What is her first move?
I would suggest that she goes for a pap smear.
Yeah.
From there, the doctor will do the staging. If it is just an STI, then treatment for the sexually transmitted disease will be prescribed.
Okay.
If it is a lesion, they will decide is the lesion invasive or not, is the lesion cancerous or not.
Yeah.
And then from there, with cancer, there's different type of treatments. So each person will get the individual care plan for that.
Right. You know, the problem is with STDs is that there's so much shame attached to them, where I think a lot of girls perhaps aren't going to healthcare professionals out of fear and shame, and this could lead to them getting very, very sick or perhaps dying. Thank you so much for educating and helping us understand this virus a little bit more. Join us again tomorrow as we sit down with women in beauty business and, of course, in fashion. And thank you so much for joining us today on the show. We'll be back again tomorrow. Good night and God bless. Thank you very much.
Afternoon Express, made with love by Clover.
Another feel-good production.